Hi, I'm Dr. Bill Lyle and I practice obstetrics and gynecology. So, why am I holding a dime? I'm holding a dime because a lot of you and myself have been getting lots of ads for the March of Dimes, especially on Facebook. Most of my younger patients have never even heard of the March of Dimes, so we're going to talk about it a little bit. The March of Dimes was actually founded in 1938 by Franklin Delano Roosevelt, and originally it was known as the National Foundation for Infantile Paralysis. Paralysis amongst kids was highly feared back then, especially from a virus called the polio virus. And they were looking for research, for funding, for finding a vaccine for the polio virus, but actually for helping to care with these kids and with their families who are suffering from paralysis. Well, the fundraising was picked up by a radio star. His name was Eddie Cantor. And Eddie Cantor wanted to help out, and he had a radio show at the time called March of Time. Well, he kind of played that on words and came up the March for Dimes. And he encouraged people to send a dime to the White House. Just put it in an envelope and send it in. In a short amount of time, they raised over $85,000 in dimes. Now, first, that wouldn't be a great fundraiser because it cost you 55 cents to mail in a 10-cent dime. So that wouldn't be cost effective. And also now with hospitals and research, a dime doesn't buy a whole lot. But it was amazing how a lot of people contributing a small amount to one organization can really make a difference. So why did they put the picture of Franklin Delano Roosevelt in 1946 on the dime, and why is Franklin Delano Roosevelt's portrait now in your pocket? It was because of his efforts and his encouragement of fundraising for a great organization. Well, now that we have real effective polio vaccines, and we really don't see many cases of polio, what does the March of Dimes do? Well, they've shifted their efforts over towards working against preterm delivery of babies and the care of babies once they're in the NICU and they have been born preterm. Now we have babies that are surviving, whether it's 14, 15 weeks early, maybe even 16 weeks preterm, they're surviving in our NICUs, which is pretty amazing. We have amazing technology, doctors and nurses, and we treat these sometimes a little bit more than a pound babies as patients. They can have intubation where they can have breathing tubes. We monitor them, their nutrition. Sometimes these babies will spend the first year of their life in our NICUs. Our NICUs in our cities and our towns are an amazing asset that saves lives. And we need to be thankful for having these facilities and having these highly skilled doctors and nurses to take care of these kids. Well, we don't just treat these kids that are born at 23 weeks, 24 weeks gestation as patients. Now with modern technology, we can even treat them as patients even while they're still in the womb. At centers around the country, we can do blood transfusions directly to the baby as early as 18 weeks gestation. We can actually even do surgery on the babies on the inside of the womb. We can do heart surgery. We can do spina bifida surgery. We can do laser surgery as early as 22 weeks gestation. It's amazing the technology of how we can treat the preborn as patients. I'm a real big proponent of patients' rights. And if we are doing blood transfusions, heart surgery, spina bifida surgery, placental surgery on the inside, then the babies on the inside are patients. And if they are a patient, they are a person. And if they are a person, they deserve our protection. So God bless you. Be thankful for your NICUs. Be thankful for those in your community, like your pregnancy resource centers, which are doing their best to raise dimes, to raise funds, to protect the preborn. We're all created in the image of God at that moment of conception. A patient is a person, no matter how small. If you have any questions, you can contact me through my website, prolifedoc.org. Have a wonderful Hanukkah, have a wonderful Christmas. God bless you, and I'll talk to you later.